Hello, and welcome to my capstone seminar presentation, which titled as Improve Healthcare Access for Rural America Using a Telehealth Services, specifically focused on a patient with an endocrine disorder such as diabetes. Background of the study. So the I try to understand why the rural population having the diabetes disorder or why the prevalence is more, and couple of reasons came out of in that background information. One was the major thing was the barrier to healthcare in rural population, and those were barriers are like geographic barriers. So if you look at the rural population, the population tend to travel longer distance to get a care, and compared to their urban counterpart, and sometimes they don't have a mean to transportation, so that's another challenge they have it. And if you look at the amount of the health insurance coverage available in rural population is lower than their counterparts in urban population, and they have a rural population have a tend to have a lower health literacy compared to their urban counterpart. And mostly rural populations are very close knit, they know each other, and that tend to create social stigma and privacy issues, such as like I can go to the walk in into the certain clinic, and maybe in a clinic my neighbor might be working, because I said they are very tight knit community, because people like less population is there and they know tend to know each other, and that could cause the person to be open up about their medical condition or something like that, and then that lead to the privacy issue. And then I try to find out what's happening in the field of telehealth, and that's where I came across Project Echo. And in the Project Echo, as per the lead doctor, what was his mission? His mission was to take the healthcare from his boundary or walls of that four walls of that provider care to the community, to the larger section of it, to be the to the across the state, across the country, and across the world. And if you look at the Project Echo, that's what he tried to do it. Like he has a satellite offices across the world, and he's trying to reach out to the community from the various part of the world and country. And as all we know, the for any paper, the literature review is the very important thing. So as I was doing literature review, I was trying to find out what are the main areas I'm focusing, and obviously the telehealth is the first one. So I try to describe here telehealth. The telehealth is deliver the healthcare remotely using a technology such as a mobile app, SMS messages, audio, and a video call. So when we are delivering a care remotely to the person by using the various technology, it could be that patient is using mobile app to see his medical record, or to communicate with his provider, or check his tests, or results, lab results kind of it, or maybe he's talking to his doctor using audio and video technologies. So that's all fall under the telehealth. The next thing was that I am talking about diabetes. So I was trying to define what is a diabetes. So here is the quote from NIH, which is diabetes is a disease that occur when your blood sugar, blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, hormone made by the pancreas helps glucose from food to get into the body cells to be used for energy. Sometimes body doesn't make enough and or any insulin or does not use insulin well, and that's what the condition is reached to the diabetic condition. So that means if I am whatever I'm eating, that has to be converted into the energy or glucose, and that has to be done through the insulin. If these activities are not happening, that's the condition is a diabetes. So if we go deeper into that, what it's trying to say is that if I eat well, if I do exercise well, where I try to burn what I eat, I can very well manage my diabetic condition if I know all this information, what I'm eating, how it's impacting my insulins and sugar level. So that's what we will try to explore. That's what we try to explore in this capstone paper. And then finally, I wanted to tie all those things with how I'm going to use the IoT or medical IoT device to achieve my thesis, or what my main goal for this paper is, where I wanted to use the medical IoT device which can collaborate or correlate with other informations available using the various technologies such as Fitbit or food based app. So if we have a glucose continuous glucose monitoring which can give me my insulin level at every 5 minutes, that means I know that when I ate that pizza, how my insulin was, or when I took that long walk in the evening, how my insulin was. So I can avoid certain food, I can avoid certain exercise if it's impacting my ability to maintain my insulin, or I can encourage that exercise where I can see that it's helping me. So that's know-how is going to be built around this IoT device, which is called the continuous glucose monitoring device. So, solution wise, we are focused on the continuous glucose monitoring and active monitoring, using that technology to actively monitor the insulin level, and that makes the diabetic condition person to proactive to manage the care. So by doing that and by giving these devices to the rural population people, where they cannot always go and see their medical provider, but now medical provider can see their conditions all the time if he wants to. And so this is what gonna remove the one of the barriers where the access to healthcare is becoming a more possible for the rural population. Recommendation. So our study was not that deeper, because you all can understand this is just paper, and due to the COVID and time limitation for this particular course is so limited, and no much resources are available to go deeper into the study. So definitely, if I want to pursue or want to do go deeper, we need a follow up study to do that. So go deeper and try to recruit the real patient and monitor them over a period of time, like maybe it could be 30 days or 60 days or 90 days. And definitely one thing come out of this is, like, when I see the other studies which shows that there's a value in this thing, that has to go back to the insurance or pair or insurance companies who's paying for these devices, where they should have a better reimbursements policy, which could be Medicare, Medicaid, or private insurance. So they should be able to cover these devices, because if we can show them value by having these devices on a patient, how much healthcare conditions, they can improve it, because by knowing what's happening to them, they can manage their condition in much better, and they can be keep themselves away from going into the hospital or going into the outpatient care or going into the ER rooms. So that is going to save a lot of money for the insurance provider and overall the healthcare systems. And most important, these patients can be more healthy and manage their condition in much smarter and greater way. So, in conclusion, I would say that continuous glucose monitoring, in a combination of the other technology, has a power to improve the life of the diabetic patient. Who is the remote? I'm just focusing on a remote aspect of it in this paper. So I would say that for the remote patient where they cannot easily access the medical care, they cannot easily access to the doctor due to the certain barriers which we have discussed in this presentation earlier. So by doing this, the medical care provider or medical team of the given patient know their insulin level at any given point of time and see the value, right? Where instead of he's coming to medical provider's office, medical provider knows what is his condition, and he knows that at what point of time his insulin level goes up or comes down, and in combination of what else happening to him, and think about how much value it can deliver to the patient. And it's going to become much easier on the provider side also in visits or whatever time if rural patient is getting in front of the provider. And this is like a win-win situation for all of them. My connection to the subject, I'm by no mean I'm like part of the medical or clinical profession. So I never knew this all those things before I got assigned to one of the project at my workplace at IBM, which was in collaboration of the Medtronic Diabetic Division, where we were trying to work through the one of the project which was called Sugar IQ, where we were trying to use the power of the AI and data analytics to work with the patient and give them this CGM devices and see the what other correlation factor comes into the picture, and that can make and learn about that patient, and based on that history we can make a prediction to the future, right? Initial goals were there, like where we can predict certain condition in 4 hour advance for the patient. So that's where my connection came into this subject. And plus, uh, by working on this project, I get to see certain studies which Medtronic has conducted with American Diabetic Association, where they were giving a testimony, these patients who are using these devices, like by using these devices, how that has helped them to manage their care, how that has helped them to improve their life condition, how that helped them to live better life compared to the earlier. So that all those things, when I saw that, I could make a direct impact on a certain person. As IT is everywhere, but most time I don't know that direct impact. But in this project, what I had opportunity to see that how I'm impacting the patient directly with my work, and that's what made my connection to this given subject. Thank you, and I hope you enjoyed my presentation. And these are my references, which you can go through on your leisure time with my presentation charts. And thank you again.